Hello friends, welcome to SERUMMEDICO. First, I am going to discuss about a small case, then we can go into the topic. A 45-year-old patient with splenomegaly, fever and a longitudinal ulcer in the intestine was died. What will be the diagnosis? Okay, we can come to the diagnosis after the discussion. First, we can see about a common topic, enterobacteriae. The name entero indicates mainly GIT. What are the bacteria which come under Enterobacteriaceae are E. coli, Shigella, Salmonella, Proteus, Serraceae, Yersinia. These are the enterobacteria, some of the enterobacteria. What are the common features for this or general properties we can see about it? All are gram negative bacilli. All are catalase positive. Some of the microbiological features and oxidase negative and nitrate reduction. And glucose fermentation positive. There's a one main difference in this type of bacteria, which is lactose fermenting and non-lactose fermenting. Only the E. coli is lactose fermenting. Should be an MCQ which can be asked. So the following bacteria is a lactose fermenting bacteria. This bacteria can be given. The option is E. coli. Okay, and then we can in this topic, in this video we are going to see about typhoid, Salmonella typhi. Typhoid. Before going to the topic, I am going to say about a small story about a lady who her name is Mary Malone. She lived in US during 19th century, and she was working as a cook in a hotel, and during some days the around 10 people who were working with her in the hotel were suffering from severe diarrhea and died. And after she started working with in a home who is a lawyer, and there 6 people were affected for diarrhea and 3 people died. And again she worked in US in another place as a cook, and there also around 25 people were affected and 25 people were also died. And on post-mortem they were diagnosed with typhoid, and they started searching for the person who is spreading the typhoid, and they found out Mary Malone was the main carrier of typhoid, who has infected around 150 people directly. And she was quarantined for around 3 years. And again she worked in laundry, where again an epidemic outbreak was found, and again she was quarantined for a lifetime. But she refused to remove her gallbladder till her death. And this is a small story of Mary Malone. She is known as Typhoid Mary. Many people have known about her. Okay, we can go about in detail about typhoid. Salmonella typhi. Bacteria name is Salmonella. Bacteria name is Salmonella. It is also known as Ehrlich bacillus. he was the scientist who discovered this bacteria. So this is known as Erbert bacillus. It is one of the MCQ. And yes, see about the general properties in the common general properties in Enterobacteriaceae, and we can see about Salmonella typhi in detail. Salmonella typhi has a classification known as Kaufman classification. Kaufman classification, which has more than 2,250 types of serotypes, and it can be divided into enteric fever and non-enteric fever. In enteric fever, there are three types: Salmonella typhi, Salmonella paratyphi A, and B. The main difference will be H2S producing. In this present, absent, and in B, bulk. B, bulk. Okay, can be asked as an MCQ. Which of the following bacteria is non-H2S producing? It is Salmonella typhi A. This will be the answer. And next we can see about transmission. Regarding some transmission, as I said in the story, it is mainly contamination. Fecal contamination mainly will be the fecal contamination. That can be food, water, and this is the main route of transmission. And next we can see about clinical features. First we can see, and next we can see about microbiology. For the clinical features, the incubation period is 5 to 21 days. 5 to 21 days. And some important clinical features I want to mention: step ladder fever. And typical rose spots will be seen on third day, especially on third day on the forearm. We can see a typical rose spots and coated tongue. You see the tongue, it will be like it is coated with a white cream. It will be coated tongue. This are the three main classical feature of a typhoid which can be diagnosed clinically. So step ladder fever, rose spots, and coated tongue. Next we can see about investigation. When a person comes with fever for 7 days, and he or she is taking paracetamol and fever does not subside, we should directly go for the investigation. Main investigation regarding typhoid on the first week. Regarding typhoid, it can be investigation can be based on the first week, second week, third week, and fourth week. Everybody will be knowing the mnemonic BASU. First week it can be bone marrow, or blood culture. Second week it can be antibody detection, which is Vidal. I will discuss in detail. And third week stool culture. Fourth week urine culture. First week, second week, third week, and fourth week. Which is important MCQ. What will we do in the first week? What will we do in the second week? When the Vidal test will be done? It is done during second week. Okay. Then first we can see about bone marrow or blood culture. What is the medium used? SS agar, Salmonella, Shigella agar, Salmonella, Shigella agar, or DCA medium, deoxycholate agar. Third can be WB, Wilson, Blair, medium. Actually, these three can be used for most of the enterobacteria type because the name is Salmonella and Forshigella also. And deoxycholate agar and Wilson Blair medium can be used for most of the enterobacteria type. And this three medium will be producing H2S. As I said in the general properties of enterobacteria, all are H2S producing. H2S producing, which produces jet black colony or fish eye colony. Jet black or fish eye colony. It is one of the MCQ. What is the which of the following agar can be used for the enterobacteria Salmonella agar, DC, deoxycholate, Wilson Blair, and which bacteria produces jet black and fish eye colony? It is known as Salmonella. And next we can discuss about antibody detection, which is known as Vidal test. Vidal test, which is one of the important test you have to know. Regarding Vidal test, we used 4 antigen. First, okay, we use 4 antigen. O antigen, H antigen, O antigen, somatic antigen, H antigen is flagella antigen. This will be present in the bacteria, and O antigen is present in Salmonella typhi. H antigen, all 3 types, Salmonella typhi, paratyphi A and B. O antigen reacts with factor 12. And H antigen is specific. And next we can discuss about the tubes. There are 2 types of tubes, Dreyer's tube and Felix tube. Dreyer's tube is conical, Felix tube is round. Dreyer's tube is for H antigen, Felix tube is for O antigen. And in a Dreyer's tube we can see a fluffy wool agglutination, fluffy or wool agglutination on testing. And in Felix tube we can see granular agglutination. It will be like somewhat granular agglutination. Fluffy, it will be like fluffy, it will be like granular, conical, round. Can be asked as MCQ. Which in Dreyer's tube which antigen is used? H antigen, Felix tube O antigen, and it will be fluffy and granular. Next we can see about treatment. Treatment mainly will be drug of choice will be cephalosporins. Which inhibits cell wall synthesis, and will be using third generation ceftriaxone. And regarding carrier, for carriers we do bile culture and stool culture. And drug of choice for carriers will be ciproflox. Antibiotics will be given for 7 days. And we didn't discuss about the clinical features. Complications. We discussed about the clinical features, and complications are mainly will be intestinal perforation. Intestinal perforation which occurs on 3rd week. and patient can have splenomegaly on later period during complication, and mainly intestinal perforation means ulcer leading to perforation, longitudinal ulcer. The main keyword is longitudinal because in TB there will be different type of ulcer, so keyword will be longitudinal ulcer. And regarding vaccination, we have a typhoid schedule. It is not included in the immunization schedule, but it can be asked. It is taken on day 1, 3 and 5, and these are the most important MCQ will be asked. And some of the MCQs it can be asked are I said Salmonella bacteria are motile, and some, 2 types of Salmonella bacteria are non-motile. Non-motile Salmonella are Salmonella gallinarum and Salmonella florum, and it is one of the important MCQ which can be asked. And these are the important points about Salmonella typhi. And thank you for watching the video. Please give your valuable comments and share the video.